The discussion today, I believe, is going to open up so many that has been going wrong. Why am I saying this? We understand that with policies that so many of us, the old mind of policies that people have been adhering to, has also partly contributed to somehow problems. But I believe the mindset that are going to be here today under sustainability and narrowing it down to the community and understanding even in the education part, we are going to get the rightful solutions to problems that can help us move without rushing for some help. Thank you, Doctor.
Thank you so much. And with that, we want to welcome formally one of our new global guests and scholars from Nigeria, and that is Mrs. Onome. Can you talk now, Mrs. Onome? You are on mute. Open your mic, please. Open your mic. Just greet the community and introduce yourself.
Okay, hello, Doctor. Good morning. Good morning, Doctor. How are you doing?
I'm doing fine. Thank you.
Okay, please, I am Carolee Omulo. I can see you. I can also see Mrs. Warawa, Lovelyn Udo, and a few other persons. My name is Engineer Onome Wilkinson. I am the president and founder Oloibri Oil and Gas Entrepreneurship Development Initiative. And I'm a chemical engineer for the past 10 years. And this NGO that we've had is an NGO that actually had been meeting the needs for students in energy education. We have been seeing how we could reach out to students to begin to get involved in energy education early. Because here in Africa, we have had a handicap in that people always wait till they graduate from the universities, and it's been causing a whole lot of problems. My NGO actually started in 2017, but prior to that time, we had a basic challenge in 2015 when we were doing career programs down. If you live in Nigeria, we have the creeks, the Niger Delta creeks. And we went there to do a career talk. And while we were there, we met with a student, an 11-year-old boy. And we told him, he said, "Hello, young man, what would you love to be?" And he told us categorically, "I won't carry gun, oh, madam, money day there." That day I wept. And I knew if we don't take proactive steps, there wouldn't be posterity for us in Nigeria and in Africa.
Thank you.
And so we came up with how can we get the communities involved in energy education early, the locals, how can we get these children involved in energy education? And that was how Oloibri Oil and Gas Entrepreneurship Development Initiative was born, to be able to meet with the needs of these children. So that is
very interesting. And we are going to have the full story and also some of the issues around it later. So, Ms. Warawan, thank you so much. Please proceed with your presentation for today.
Thank you so much, Doctor. And before I present, I would like to give the brief information about me, because last time I came late and I didn't introduce myself to everyone. Very brief, my name is Warawan. I'm from Thailand, and I am the founder of the company which is called FN Educon. Even we call ourselves as a business sector, but we work very closely with the NGO at the local and international level. So our client, more than 90% are the NGO, and we do a lot of research and also evaluation project in the nature of the social development as well. So today, I'm not sure if I can share my screen from my end.
Yes, okay. I have opened the sharing. Yeah.
Okay, thank you. Okay, I hope that everybody can see my screen, and Today, I will present a very brief, because when we talk about the policy, it is a lot of things that we need to talk about. But the training session today will be very brief, and I think it will be like the introduction of the today's session that can lead everybody to the further discussion in detail. So the training session for me today is a policy development, implementation, and management. The objective for today is like we try to understand the key status of the policy development, how we develop the policy step by step, and learn the best practices for the policy implementation. That I pick up one of the policy from Thailand focusing on the healthcare of the Thai people, which is called Universal Health Trim from Thailand to be the example. And lastly, we try to explore the effective policy management strategy. Right, and the agenda for today, it cover three components that I mentioned: policy development, policy implementation, and management. And also we end up with a Q&A and conclusion. So in terms of the definition and importance of the policy development, there are two things that the good policy should be. First one is the policy development should involve a creation of guidelines and principles that govern organizational behavior and action. It means like the good policy need to change something in the area that they are relevant to. If it is related to the healthcare, it can change the behavior and the organizational management and that related to the healthcare system. And the second one is it should be effectively provide a clear framework for decision making and ensure the consistencies and compliance within the organization. Because there are a lot of policy that sometimes we found that the policy are contradictory to each other. So in that case, it will be very difficult for the implementer to implement effectively that policy. And when we come up with the status, how to develop the policy, the first step is to identify the problem. Why we need a policy? Because to develop the policy, it takes time. In Thailand, sometimes it takes almost 10 years to develop one national policy. So in this case, we need to recognize and define the issue that require a policy. If it is really, really necessary to develop the policy or not, or it is just some rule is enough. So we need to identify and recognize that. Secondly, we need to do the research and to do the analysis. We can gather the relevant information that is from if you have the university, the public university, maybe the data can be from those university in your country, or maybe the research institute, or in Thailand, we many times we use the data from the National Statistic Institute that can provide us the statistic information to make us clear in terms of the problem or necessity to develop the policy. And the third one is a policy formulation. We need to draft the policy document, and that include goal, objective, and guideline. Because if we don't know the objective of the policy, maybe it will make the stakeholder misunderstand the policy goal and objective, and they will practice something very different from what the policy initially want to. The next step is the consultation, especially the policy at the national level. We need to do the consultation with all stakeholders. It can, especially the target population. For example, if the policy target the youth and children, we need to include youth and children in this step, or even ask them to develop the policy together with the adult policy makers, because we need the perspective perspective of adult and children would be different. So we need to consult with them. And some country or sometimes we call this consultation as a public hearing. And it will not be only one consultation. So it will be one consultation, then we amend the policy, then another consultation, and then we amend the policy again. So it can be 3 or 4 consultation, depends on the detail of the policy. And the last one is the approval. If the policy is good enough, and it will be approved by the relevant organization or agency, it can be the government, for example. And the policy implementation, as I mentioned earlier, that the example that I used today is called universal health scheme. It means that this kind of universal health scheme is, or UHS, is developed because the problem that the poor and the rich cannot equally access to the quality medical health care. So for the rich, that's fine. They have enough money to afford to go to the private and expensive hospital. But for the poor, they don't have enough money, and some of them got sick with the chronic diseases or the non-communicable diseases. So in this case, that is why it become the problem of the Thailand right now, especially when the country become the aged society. So we need to have the policy that can solve the problem in this dimension. So this is the first step we call policy identification. It is like the problem statement of the policy, and then we do the research and analysis. So we do the research and analysis in the other country, if they have what kind of healthcare system that they have, and then how to apply it or how to customize it into Thailand. And also we need to evaluate the economic implication, because when we talk about the public policy, it means like the government need to spend a lot of money, and how the government can find that kind of money. So it can be from the taxation, and it can be from somewhere else. So the government need to think about that as well. This is the second step. And the third step is the policy formulation. So the UHS policy was formulated with the goal to provide a comprehensive health coverage to everyone in Thailand, to all Thai citizens. It means if you are non-Thai, you cannot access to this policy. So you need to buy the health insurance by yourself, like the migrant workers need to do it right now. So this kind of policy, yes, it is cover all the Thai people, but you need to have the Thai ID card. Otherwise, you need to go somewhere else to some channel for to protect and prevent your healthcare. And the next one is the consultation that will help with the healthcare service provider and the government official, especially the government official in the relevant ministry, like Ministry of Public Health, that need to take the main role to implement this policy. And the policy was approved finally by the Thai government after the thorough review and endorsement by the Ministry of Public Health. So the development of the UHS need to identify the need for equitable healthcare, conduct extensive research, formulate the policy with clear objective, and consult with the stakeholder, especially the target population, and obtain the government approval. The second component that I would like to mention is the policy implementation, that plan for necessary resources such as training material, staff time, and budget. Not only the time of the staff, but also the manpower. Do we have enough staff to take care of this or to implement this policy, for example? So there will be some steps that we need to take into account. Firstly, it is about the communication, that the clear communication about the policy to all stakeholders is necessary. So at that time, when the Thai government would like to promulgate this policy, the Thai government launched an extensive public awareness campaign, especially for the poor and people living in the rural area. Some of them have the problem in terms of reading and writing. So we need to find some media, or we need to collaborate with the television channel to promote this policy and let them know that right now they can spend very little of money, like $1, to go to the hospital, and then the hospital will provide them almost free of charge of the medical checkup, the medical health, medical treatment. The second one is the training. We need to train the healthcare service provider to let them understand why they need to do this. That is the first point. The second point is their responsibility regarding this policy. And the last one, the third one is the resource allocation. As I mentioned before, how we can find the money, how we can find the manpower, how we can find the resources, for example, the medical supply that can support the implementation of the policy. And the policy implementation, one component that is very important is monitoring, because we need to set up the mechanism to monitor the implementation process, like the regular monitoring and evaluation should be conducted to assess the effectiveness and coverage of the UHS, and more importantly, it can be the database to amend or to improve the policy in the future. So in summary, the implementation of the UHS, we need to launch a public awareness campaign that would be very varied based on the capacity of the people, and provide the training to the healthcare service provider, allocate resources, and establish monitoring mechanism. And the third component is policy management, that right now the UHS policy is still implementing in Thailand. So to manage the ongoing policy, we need to do the continuous management to ensure that the policy can be implemented effectively and relevant over time. So the key strategy for the policy management, first of all, we need to have the regular review to assess the policy effectiveness and relevance. And if it is not effective anymore, we need to find a way how to solve the problem. The effectiveness will be related to the healthcare need of the Thai people. For example, for like the COVID pandemic, at that time, we need to change a lot in detail of the UHS to allow the people to allocate the resources for the people who are the COVID positive to access the proper medical health care. And the feedback mechanism that the good policy need to listen to the people, to the voice of the people and the stakeholder. That will be the database for the policymakers to improve the policy. It can be through the survey or the public forum. The next one is a compliance mechanism, compliance monitoring that need to comply with the audit, survey, and performance evaluation. So the organization that take lead on this is Ministry of Public Health, together with the other relevant agency, for example, Ministry of Education, because for some part of this policy related to the children as well, and to ensure that the healthcare provider adhere to this policy. And the fourth one is update and revision. As I mentioned, if we can find some gap, or if we encounter the new disease or the new healthcare problem, maybe we need to update the policy based on the feedback and changing circumstance. We maybe need to buy the new medical technology or adapt the treatment, the new treatment, and change in the healthcare need. So finally, management of the UHS is conduct regular review, collect feedback, monitor compliance, and update the policy as needed. So because this is a training, and I think we should have some kind of participatory activity. So I have the short activity that would like to brainstorm the potential challenges in the policy implementation and how to address them. So you can take a few minutes to brainstorm some potential challenges that you might face when implementing a national level policy like the universal health scheme. It doesn't need to be related to the healthcare at all. It can be some kind of policy like related to energy, money, whatever that you think it will be important. It is important policy in your country, and later you can discuss the possible solution. But I think to save time, I have a kind of like a vote for everyone that participate in this room. So you can take 2 minutes to identify the potential challenges and the possible solution in policy implementation. So you can use Menti. I think many people familiar with Menti, right? So you can click to this website. And then otherwise you can scan this QR code, and then there will be 2 questions. One is potential challenges. You can, if you connect Menti by your computer, you can type down this 8 number, and then you will see potential challenge, and you can pick up only one thing that you think it is the most challenging, it is the most important challenge in your country regarding the national policy. So I have 4 multiple choice for you here. Is a resistance of change to change from stakeholder, especially the stakeholder that will lose their benefit, and insufficient training or resources, especially for the medical service provider living in the rural area or isolated place. Maybe they don't know they don't know every procedure related to the policy, for example, and the poor communication or misunderstanding about the policy. And the last one is about the logistical issue in rolling out the policy nationwide. So let me see your answer. Okay. Not sure if you can click and choose one. It appears in your mobile phone, right? If it
Can we
appears,
run a pool for it?
Can
we run a pool for it?
Sorry?
Can we run a pool or quiz for it?
You already vote for it already?
I'm trying to open it. Yes. What is the question?
It is the potential challenges.
Potential challenges. Okay, let me just say potential challenges.
Yeah. What is the choices that you think it is
since
the
you
most?
have since you have mentioned the options, that is an option 1, 2, 3, 4. Is it 4?
Yes, you can select only one.
So 1, 2, 3, 4. So let us select only one.
Yes.
So we can attend to the question, I think.
Can you scan the QR code on this slide? If you use your mobile phone, you can scan, and then it will show you the potential challenges.
Please answer. Are you seeing the pool? Please, can you see the pool? Everybody, can you see the pool, please?
No, we can't. I can't see, Prof.
You cannot. Okay, but you can access. You already vote for it already, and you submit already.
Yes. I've not used it before. I don't know how it works anyway. Well, I think you can continue if.
Oh, sure. I will continue. Maybe I will give this set of the slide to you. You can try later.
Or we can use we can use a message potential challenge. So people can respond through via the message. Choose one. Choose 1, 2, 3, or 4.
You're right.
So please let us respond to that message. Let us respond to that message on the.
Yes. Can you access to Menti?
Yes.
Hello, please, can we see the screen again? Can we see the slides again, ma?
Yes. Can you see the screen? I am sharing the screen
Yes.
now. Can you see it?
Thank you, ma.
Yes. Or you can go to this website, and then you put this 8 numbers as the code.
Yes, please let us respond to that.
You can respond to it now.
Yes, I have sent it to the message. We can respond to it. So we just number resistance is 1, insufficient is 2, poor communication is 3, yeah, logistical issue is 4. So let us respond to it.
Yeah,
It
but
is
you
in
have to
the
choose only one.
in the comment section or the message section, the message box. You can just pick either 1 or 2 or 3 or 4.
Yes.
Okay.
Yeah.
Prof,
so you have to choose only one.
Prof has responded. Yes. Let others also respond.
Yes. Do you respond to it already?
A quick one, Doc. Can you repeat the alternatives? The 1, 2, 3, 4. Can you repeat them because I can't read it for myself?
Resistance is number 1. Insufficient training is number 2.
Yes.
Poor communication is number 3. Logistical
Yes.
issue is number 4.
Right.
You can pick only one. Mrs. Onome,
Yes.
you can pick only one.
Yes, you can pick only one only. I know it is difficult because all of them are quite important challenge, right? Or maybe you can share this, you can share your opinion later. I will leave this set of presentation to doctor, so you can play with it later. And because I have 2 questions, one is the potential challenges, and the second one is a possible solution, which is quite related to the potential challenges. So there are also 4 choices. The first choice is engage stakeholder early in the process to build the support, because you know, like let's say in Thailand, we have about like 70 million people, and all of them are the stakeholder. What I can say, but we need to engage them to provide any kind of information to make them understand, like why we need to have this universal health chip. So this is like the solution that can solve the problem in terms of the disengagement of some stakeholder. Even they lost some benefit, but how we can convince those people who lost the benefit to support us. This is like what the CSO or what the policy developer need to think about. And the second one is to provide a comprehensive training and allocate necessary resources. I think as of now, we can do the training in a different way. We don't need to do the face-to-face training anymore, but we can do a kind of hybrid training, or like we can do like we can like put it in the YouTube or Facebook channel, something like that. There are a lot of media, social media channel, or like a communication channel that we can share the training and allocate the necessary resources. In terms of allocate necessary resources, it doesn't need to be from the taxation only. Maybe we can develop a kind of economic policy to find the money from some stakeholder, and then to support in this UHS policy or the other policy that need to spend a lot of money. And we need to ensure clear and consistent communication through the multiple channel. It means like when we have a lot of channel, we have a lot of television program, all of the television program need to say the same thing. Because if they say something differently or contradict to each other, it will make the confusion among the people. And in this case, it will make the society think like, oh, this policy is not good anymore, and they will not vote for it. And the last one is conduct a pilot test and adjust the policy based on the feedback. Because like if like I say earlier, Thailand, we have 70 million people. Maybe it's quite challenging and too risky to do this policy for the 70 million people at the same time. Maybe we can do the pilot test, and then like in some specific area, then we can like do the research and analyze the key finding, and then we can better to narrow the challenges, or to eliminate the gap, and before we implement this policy at the national level. Then, okay, in summary, I think to do the policy development, implementation, and management, it is important for achieving the national organizational goal and ensuring consistency and compliance, because there are a lot of policy, what I can say, in Thailand that's not enforced effectively. And I think in other countries as well. So if the policy has been developed very carefully and very clear to the people to understand how the benefit this policy can give to them, I think that kind of policy will be effectively implemented and many people will comply with that. And by far, to do this, we need to do the structured approach as a demonstrate to the policy like the UHS policy in Thailand, and organization can address complex issues and implement sustainable solutions. And lastly, engaging stakeholder is important. Providing enough training and maintaining continuous feedback loop are essential for successful policy implementation and management. Because there is none of policy that will not be changed anymore. It may need to take some time to change because our society change every day, but I can say every second, but I can say. So in this case, we need to hear the feedback from the stakeholder or from the people that are targeted by this policy. And then in some times of some period, like maybe after 5 years or after 7 years, we can develop this policy, we can amend the policy or improve the policy. And thank you so much for your time and participation today. And I'm very sorry that I may not be able to join the discussion session because I need to attend another meeting in 15 minutes. So, but I will share this presentation to you, to Dr. Sao, and as a facilitator. And then I hope you enjoy my presentation, and I hope that I can provide any kind of like a useful information for you to start the conversation for today. Thank you so much. ขอบคุณค่ะ
Wow, thank you. Thank you so much for that very very comprehensive and very detailed presentation about the policy, and it covered all the aspects that we are actually looking at, and very sequential and very methodical. Thank you for that very wonderful presentation, and also for engaging us in that very exercise. Thank you so much for taking the time and for making it a priority to actually present, that you don't give us excuse that the meeting is on and the rest like that. So let me call on our national and co-chair at the global board, Professor Femi Ajayi, as usual, to make a remark on this very the wonderful job that Mrs. Warren has presented to us today. Thank you, sir.
Thank you so very much. Good morning, everybody. Mrs. Warawan, in fact, you really made our day, and we appreciate this sequential high and for making it kind of engaging in nature. You really engaged us that we couldn't just lose track. As you have taken us from the onset, we are able to follow it through up to the point at which you gave us an exercise to participate in. You really make it participatory enough. Thank you so very much. We are really grateful. And Dr. Sahid at DBC, thank you very much for bringing Ms. Wurawan to us. I think we also need to congratulate ourselves, especially you being the facilitator. The way you are able to identify these wonderful people and bringing them to us for us to learn from their wealth of experience and knowledge. I think it's just very great, and we celebrate you. And everybody in attendance, we now policy formulation is not just an easy task. It's not something that somebody will sit on the desk and begin to just write some things. And that has been our problem. And that's why we end up having policy somersault, policy that cannot be implemented, policy that will just be half-baked kind of, policy that cannot be accepted. We can see the import of stakeholder engagement right from the onset. And Ms. Worawan has been able to take us through this. Thank you so very much. We appreciate you on behalf of GSLSN and Nigeria.
To choose for other people how they live their families. If only and only we can leave the responsibility to the families to check how they can live, this whole problem will be solved. Take for instance, the urban-rural focus is not the right way of a governance. Choose the language and the structure on ground. Let these people manage themselves. What you can do is to maybe help them, train the trainers, so that through that we can still proceed with the system. These people will help these people understand what they need is the resources to help them do everything they are doing.
Okay, that's the perspective of Mr. Caroli, and I think there is need to critically look at the solutions that can address those issues, because they are big issues. Because not getting things right done the way it's supposed to be done, that is the best practices mistake, and that very mistake is the biggest of all mistakes that can mar any kind of a system or any kind of a process. Let's check from Professor Ajayi. What do you think about this very issue? We have seen the practical illustration, the practical best practices from Mrs. Worawan, and we have seen the true dimension from our own system, from Mr. Caroli. And it is difficult to actually resolve this issue. Very, very difficult. From your experience, what do you think? What do you think we can actually pick?
Yeah, when it comes to policy issues, there are principals, researchers, development workers, and that's supposed to guide may vary, but procedure remains the same. So whenever we are discussing such, let that immediately we follow the principles that it is principle that is common. It is not processes and procedure that is common. One thing about our own experience is that we do not adhere to principles to the extent that when we get to legitimization, we have a lot of problems. Legitimization, which has to get to the house, every political strand, and all the likes, everything that goes right from below to the top. That is the problem we continue to have. It is not as if we are not aware of the need to follow the principles. But corruption, let me just mention that. Corruption, to the extent that we do not allow professionals to take charge. Look at the proposal that we put up. Already, I begin to exercise some of my little fear. The only thing is that we are good at a particular point in time. Government is part of our stakeholders that are going to be brought into this. But will they see the way we see? The public is part of, and our own population is so enormous. And we are not equally, in fact, we do not even have facilities to hold this type of meeting. If I may tell you that every one of us that is always on this meeting, we are paying through our nose to get on to this meeting. No electricity, nothing. So the policy issue, we all know that what the presenter has presented is the real principles and is the real procedure. But you know, everybody want to cut corners. We cannot continue to cut corners and feel that we are going to get there. For instance, the stakeholder meeting, the training that's supposed to us, the awareness creation, the consultation, the training, and the retraining, and even the assessment, because at a stage, we have to still assess the policy. That was the exercise that we did. What are the challenges? We are not proactive enough. So I don't want to condemn my country, Nigeria. All I'm gunning at is let the professionals take charge. We are not saying people cannot be in government, but the professionals should be deployed. As speaker was trying to narrate. But by me, I am a positivist. I strongly believe that we can still achieve it. Though it may be slow, but we have to be consistent, like Dr. Sahid Adebisi is doing. We have to be consistent. We should not be discouraged. That's my own point of view about the whole issue. Thank you.
Thank you so much, Prof.
Planning the key stages of policy, then for us to learn best practices for policy implementation. Now, in my own angle, I want to look at where I have been working on, which is energy education. I came to a point where I realized energy poverty is a stark reality in Nigeria and in Africa. I want to look at my terrain very well. Millions of people lack access to reliable and sustainable energy. And this energy poverty has become far-reaching, causing serious consequences, like what Dr. Ajayi just mentioned now. You know, electricity is having a lot of effect on people and all of that. Now, Nigeria, if you take a stock of a whole lot of countries, have one of the lowest electricity access rates to the world. What has caused it? Policy, lack of implementation. Now, this energy education that I decided to go on to, you're calling it a very big project. Yes, it's big. It hasn't been easy, especially when we have a lot of people that do not understand this industry. We have people there that really don't get it. It's critical to sustainable development. If we don't empower the individuals, if we don't empower the communities with knowledge and these skills, then it's been very, very hard for us to unlock opportunities for economic growth. This policy that we're still talking about plays a crucial role in driving energy education initiatives. We have come this far, and without policy implementation to back us up, it will keep giving us serious challenges. I just want to take take an example from policy development stage of our discussion. This policy development has practically affected what we do. Let's take, for instance, the Ministry of Energy, the Ministry of Education, energy companies, educational institutions, and community groups. Everybody is thinking about what they will get. They are thinking about what they will collect. Like Professor Ajay, I'm looking at his word. Corruption has taken over. And these stakeholders, they are the ones that are working together to develop this policy, that are promoting the things that will better our situation, that will better our lot in life, that will better our economy. And if these persons have some little corruption in them, it is affecting what we do. Now, in Nigeria, example of education, energy education policies are like the National Energy Policy and the recent Renewable Energy Master Plan that they are working on. Then for Africa generally, because I'm also talking in terms of Nigeria and Africa, because one of our main objectives is to see that we light up Africa in our own way. The Africa's Union Agenda for 2063 and also the Sustainable Development Goals is providing a framework for energy education policy development. But how many people are actually keen into this thing? Not many people are keen into it. Everybody thinks about, to be very honest, especially from the Nigerian factor, there's a parable, they say, now where Bele lie, now we get face. But when we're thinking in those lines, then a lot of policy development will just be things that are on paper, that are not being implemented, because the challenges are just so much. Especially where I work, the energy education initiative, it is actually hindering it. We need it now. Take, for instance, like I said, my NGO, which is the Biological Oil and Gas Entrepreneurship Development Initiative, has been working with students. You know, we go from school to school. We do this free training, sensitizing the children. Oh, let's talk about energy education. Let's talk about the basics of oil and gas. They are all telling us to run away from oil and gas. And the children have not even understood that, and we are all running to renewable energy, which are the new entrants. Now, I think if we're able to have a balance, a policy document or implementation or development that will give us a balance with traditional fossil fuels and then the renewable energy, people won't get lost. I'm telling you, the problem even we have in the Niger Delta and in Nigeria and in Africa as persons, like as in people are restive, they are angry, it's out of policy implementation that are just policy documents that are just there and people are not implementing them. Now, if, for instance, the local woman in the village, please, I want to be a little local because I do a program we call Energy on the Street. I want to go down a little because if we don't look at the local people, they are the ones that are causing problems for we that claim to be enlightened, with all due respect, sir. Now, the local woman believes, I have oil underground, and government just comes, they draw this oil and go. The youth believes, I have oil underground, and people come and speak big grammar, they share money for them and go. All these policy documents or policy, the people have been sharing money and they come and speak big grammar and they leave. How are these implemented? Until what is happening to our system today. So in Africa, we've had so many other initiatives. In Nigeria, we've had so many, but how are these initiatives playing out? I pray with people like Dr. Adebisi, we will get there. Now, as an organization, because of the fact that we look at collaborating with governments, international organizations, and a whole lot, we had to start coming up with how to implement this SDG 7. SDG 7 works very well with me because that SDG 7 itself is saying ensure access to affordable, reliable, sustainable, and modern energy for all. Professor Rimruke, the Vice Chancellor of the Federal University of Petroleum, when we sat down and had a heart-to-heart discussion on how we can educate these children. And he said, look, the best way is to see that the government encourages energy education in schools. We have done that in our own little way as an NGO. We have over 500 schools that energy clubs are running, both online and offline. I know coordinators in different places. I really want to work with GLSN to see that it happens. So thank you very much for this opportunity to talk. I really don't have so much to say because I have a lot of big daddies like Professor Ajayi on and Dr. Adebisi, and I hope to actually learn from you. But I just told you where my passion lies and how I think we could work around policies for energy education to succeed. Thank you very much, sir. God bless you.
About corruption. These are the main people who are involved in this kind of activity, which is really sad. And when you go into following up, it is actually true. These people who are being arrested are serious people who have, read books and they indulge in that kind of activity. So, and it is affecting everybody. So this issue, I don't know what medicine will be done for it, but it needs to be tackled. Another thing is education. This early childhood education is very important in bringing up our children in the community. Now, these methods we are using right now in our schools, I believe they are either outdated or there is something not right, because I was reading an article where one was suggesting that students and the teachers is the old way of studying, where a student sits in the classroom, a teacher is in front, and he's the one telling the children what to do. And the children ask the teacher a question, and the teacher gives them an answer. Now, this other way of learning is where a teacher, who is now called a learner, an educator, and the students who are called learners instead of students. Now, these learners, when the educator is instructing them or teaching them, he leaves the students to go and the students ask questions, and instead of the teacher or the educator giving them answers, he leaves them to go and find the answers themselves. So they go, and that one is, I think, the best way of teaching our kids. The students go out and they ask the mom or they ask the dad, and the following day they come with the different answers. Instead of the teacher or the educator telling them 1 + 1 is 2, and that's it. They go home, they know it is 2. They will not ask anybody else. So that kind of education needs to be, streamlined and for the future. And basically, that is my views in this discussion today. Thank you very much.
Just adamantly neglected and adopted a life, so they end up living above their livings, the life standards. Take, for instance, we have acquired even the education of the Westerners, and after this, we want to stay in big houses, whereby even these big houses come up with other funny diseases if we are not keen. If we can, for example, stay in our grass-thatched houses made of cow dung, but we live safely and avoid these tiles houses. This is an example I'm trying to give. So if we can balance all these by so reintroducing education, we are going to achieve a lot, because even this manner of corruption is because of greed. If we can simply try to adhere with the 4 principles and avoid this greed and all that, these corruption things will not be there. And lastly, how can we pretend that I want to go and help Dr. Zoa in his home before I help my home? All these things are fallacy. These are what we are trying to do, and they are leading us to problem which we are facing. Back to you, Doctor.
Thank you so much.
Even hearing from them. And I think that's my own take. Before we talk of policy, we must talk of inclusion. We must include the people. We must hear from them, find out what's compatible with them. Okay, I'm going to end with there's this project that was to take place in a part of the northern central part of Nigeria. And now you said these people, they are used to working with their donkeys and cattle and oxen and all, and you say you want to replace it. You don't want animal brutality. You want them to work with tractors and plows and all. Now you go and buy a 38 million naira tractor, right, for a community. How are all the farmers supposed to share it? 1, 2, they have to fuel the diesel. They later, mechanical gadgets and drama. Today something is not working, tomorrow another thing is working. You have to pay the operator. Are you even thinking, is it cost effective for the farmers? They've been working with their donkeys and oxen for years, and they're doing well. I mean, they're doing well. Why are we now bringing, like I think Mr. Caroline said, why are we bringing the Western culture to? We're not even okay. Nobody even checked if the soil type is compatible with the tractor that was bought. The idea is, yes, we bought tractor, and they flaunt it, and they say they did. You used how many billions, and the tractor is now parked somewhere. It's not working. The villagers that should have left to work with their oxen and just found out we can better things for them. Now they're stranded too because they disposed their oxen thinking that you had good plans for them. So, there's a whole lot to this policy development thing. But for me, I think the basic is we don't even know the people we are building the policies from. And that's already a big problem between the government and the people. And I think only those of us in research, just are really willing to do the work. I mean, many of you have been paying the sacrifice for years, can bridge that gap. I think that's my humble take. Thank you, sir. Thank you, Maya.
Yes, thank you. I think that's another perspective. And it was defined in the early 70s to 80s to 90s. It takes time before it is now finally redefined the development agenda of the whole world in 2015. Look at that very lifespan, which means that the consistency is what is going to win the world to change. And that is what we all need to actually maybe adopt. If we are consistent and we are getting results, people are going to align. And the more people want to be realistic, the more people want to seek the truth, the more we change the society. And that is what has led to the proposal we have been able to submit, because it is very difficult to actually submit that very kind of a proposal. I've been in so many systems. Float a proposal, you are on your own. You want to do anything in the community, you are on your own. But because of the consistency that many people that have the same focus are aligning, and that is what brought up Mrs. One all the way from Thailand. Because on our first meeting, there was a diagnosis. In fact, we exchanged an idea of who are you, what are you doing, and the rest like that. And we are trying to align the thoughts, and we are trying to align the activities. And we are seeing that, okay, there is a kind of a alignment, and the alignment is stronger than what we can say the differences. And that is the reason why we have been able to. And that is what is happening to all the stakeholders that we have been working together on GSLSA. They all have their domains, they all have their systems, but they believe that here, I think there are more to what we are doing than what we believe or what we believe can be achieved. So where I am driving to is that all these problems, all these challenges are something that we can surmount and we can overcome. And the people that we think are difficult, they are not difficult, but they want evidences and they want the truth so that they can align with the truth and they can all make the changes that we are all maybe looking forward to. And that is where I want to draft that very line in our mind, that yes, we have problems, but the problems is not really the problem, but ourselves can make the problem solved if we really admit and agree to work on those problems and consistently making it a song to sing for the people to dance to. And eventually they will dance to it, because when they see that this is the truth and this is very sweet and it is danceable, and they are going to dance to it. So, Mrs. Onome, what do you think about this very idea? People will change, but we need to be committed to change them.
Doc, I want to appreciate you once again. I believe with GSLSN, a lot of changes will happen. Most times it takes only one person that will trigger the change effect. Not the APC change. Okay. Yes, I just wanted to look at what Mrs. Loveland said and buttress it. There were some things I didn't want to talk about because I'm also trying to, I've spoken in certain forums and I'm being very careful to speak, before people will think of you and look at you differently. Now, you said charity begins at home. Sir, that is number one, the key thing that has happened, that is happening to our system. Charity begins at home. I was telling somebody the other day, I said, my grandmother, when her first son came in from England, he brought so much money. And she said, I would not eat it until I know where this money came from. But today, a mother would allow her child go out, bring in so much money without asking questions. Now, that is the problem in the society that has been translated even to the political forum. And like we said, the whole corruption system is even from home. Now, to create policies that are realistic, not policies that people will just wake up and sit down and they share money when they are doing the policy documentation and they share this thing, and at the end of the day, somebody comes and tells you something that is not realistic when you don't even know the people from the local communities. So that's all I have to say. Thank you very much, sir.
Wow. It has been so wonderful. And yes, we look forward to activities and actions that are going to transform our society. And together, like I said, we can do it. And we have started it. And it's going to be amplified. And it's going to touch the heart of the people that we are actually concerned about, and that is making progress in humanity and making progress on the sustainable development. So what you have mentioned. Yes, Mr. Wanjuzi.
Yes, thank you very much. Now, in Uganda, I don't know whether you're aware of there's this oil company called the ECOP. And I am one of the advocates who are not supporting that project. But after listening to what the speaker was just left saying, that there are 200 plus products you can get from that crude oil. This is something I didn't know. And of course, I'm going to look into it. But still, Nigeria has been doing this crude petroleum for a long time. And we are not seeing a significant change in the areas where they're operating. I mean, the people, the standard of living. Some people are still in poverty. Others are not doing well. Well, here in Uganda, drilling the oil, have built schools, have built hospitals for the community. But I don't think that is enough compared to the damage they are going to do, on the environment. There's a lot of chemistry around there, that issue. So, to have learned that there are very many products you can get from oil. So, that is something I've picked from today's program. Thank you.
Yes, thank you so much. And that is the essence of some of these very discussions. And thank you so much, Mrs. Onome, for the wonderful work you are doing. You have started so very briefly, and of course, we are going to continue to also inject some level of ideas and innovations and also activities to make it work, not only for the region where you are with domicile, that very project for the whole humanity, because like Mr. Wajuzi just said that you see he has been able to pick some of very vital information from what we have discussed today, and that was what actually happened on that day as well. Many people actually we begin to get informed, get more information, and get more clarification. And these are the issues that we will continue to do. And that is happening to researchers as well. I have attended so many research presentations that the researcher will have done the work, completed the work, and somebody will just ask a question. And the researcher will be like, I have done so well, but there is something missing in this very research that needs to be looked into. And that is the essence of getting better on the activities and also issues and how to find solutions to sustainability. So it has been a wonderful experience. It has been a wonderful time with all of us. And yes, if we don't have any other comments, we can end the session for today. And we thank everybody that has been part of this. And I believe that our other members are going to watch at their convenient time, because we know that there is festival for the Muslim faithfuls around the world now. So I think everybody is getting busy traveling and doing one thing or the other to actually rejoice with their families. So I think they are going to watch the session later. Let me call on Ms. Loveling to thank all our guests for today, and also we close the session by that appreciation remark. Thank you.
Okay, can you all hear me, please?
Yes, we can hear you.
Yes, we can hear you.
Wow. So on behalf of the Global Scholars and Leaders Network, I want to say a big thank you to all our presenters, from Miss Warren, who had to leave for another meeting for a presentation. Thanks to Mrs. Onome our discussions were eye-opening. Thanks to Dr. Simeon, Professor Ajayi too, and to everyone who contributed. Thank you for your time. I know it's weekend and we all have things to do. Thank you for coming. And I'm going to say very sincerely that I am glad that I'm a part of this network, and I'm honored. I learned a lot today. I'm sure I learned so much, and I'm grateful. Thank you so much for coming, and we hope we will do this long term, and in our lifetime, we'll see things get better for Nigeria, for Africa, and for the world at large. Thank you so much.